Hello, everyone. My name is Cherissa Jackson. I am the Chief Medical Consultant for Bees Knees Wellness. Welcome to the Hive. We are an educational platform that's going to be bringing information to the community about the benefits of plant medicine, how hemp products and hemp-derived products can really help your health and overall wellness. And so today, I'm honored to have a good friend of mine, Dr. Hinson, here to the Hive. He's going to talk about the benefits of plant medicine as it relates to heart disease and some of the things that he's doing in the community as it relates to heart disease. So let us all give a warm welcome to Dr. Hinson to the Hive. So thank you, Dr. Hinson, for coming to the Hive today. Tell us about yourself and what you're doing.
Yeah, much appreciated. Again, my name is Dr. Maurice Hinson. I'm a general internist by training. I usually say that because I think in spirit, I'm more of a naturopath. I got my bachelor's in neuroscience at Johns Hopkins, and initially I wanted to be a brain surgeon until I followed one, and then realized I wanted nothing to do with their lifestyle. But it's interesting that now the neurology pieces and the neuroscience pieces coming back full circle as I talk about plant medicine in a variety of ways. I went back to Philly where I was born and raised to do my medical degree at Drexel. And then I came up north to New York Presbyterian Weill Cornell to do my training in internal medicine. And since finishing in 2018, I've worked as a hospitalist in a number of different hospitals, rural and urban. I've probably worked at 20 different hospitals in total. As of 2 years ago, I launched MetaRoots Medical Group. All right, which is a telehealth-based primary care practice where we specialize in the delivery of high-value care. And by high-value care, I mean, the type of care that actually benefits health outcomes and not just numbers, that we improve the patient's quality of life by focusing on the root cause of disease and not just symptom management. And we do this in a myriad of ways, but we pride ourselves in being able to build out an integrative medical comprehensive therapeutic regimen. And, in my opinion, that affords the greatest therapeutic benefit where you can combine the advancements of conventional medicine with the known therapeutic benefits of traditional medicine. And so now I'm in this space of discussing plant medicine, how it relates to tackling a lot of the issues that we see ourselves dealing with today, especially around chronic disease. And you have no greater chronic disease that's more impactful than heart disease.
Yeah, and I think that's huge, particularly not only in our community as African-American community. Heart disease is rampant across the country as a whole in healthcare. I mean, I can tell you how many patients I've treated, and probably their number one case of some of their conditions is heart disease, either high blood pressure, high cholesterol, you name it, it's heart disease. So let's talk about how the plant can actually help people with heart disease. What are you seeing and what are you doing that's helping people as it relates to heart disease?
Well, first you have to take a step back and actually understand why heart disease is heart disease, right? What's the source of it? Again, getting to the root cause of the issue. We see globally heart disease really taking off, and in epidemiologic terms, it is a true pandemic. It's not infectious, but it unfortunately, almost twice as many people die from heart disease as any other ailment, and what's so disheartening about that is that it's almost entirely preventable.
Mm-hmm. Mm-hmm.
It's almost entirely preventable. I know a lot of emphasis gets placed on the genetic predisposition, but I always tell people your genes aren't the only things that you inherit from your parents. The condition in which you live, dietary habits, lifestyle choices, stressors, stress coping mechanisms. All of these have a much more profound impact on your health outcome and the progression of disease, really, than your genetics, when you boil down to it. But when you break down heart disease, you have a myriad of risk factors, right? You discussed many of them already: obesity, high blood pressure, high cholesterol, diabetes, stress, right? And when you really break it down into a cellular and molecular level, what we're learning now is that most of these chronic diseases are the result of chronic inflammation,
Mm-hmm.
right? And this is something that was discussed, decades prior, that we're really just now beginning to understand from an academic standpoint. And when you break down chronic inflammation, well, I break it down into four buckets. Okay. You have a infection. Okay. You have what I call toxic consumables, right? So toxic air,
Mm-hmm.
toxic food, toxic beverages,
Mm-hmm.
even toxic thoughts, toxic words. These have a profound impact on how we prime our body and how it responds to the environment. Having toxic people around you, there's more to your health than just your biochemistry, right? Another bucket is poor flow.
Mm-hmm.
Okay, so poor blood flow, um, uh, poor lymphatic flow, poor flow of that spiritual energy, that vital energy, that the ancient Africans called the Ka, and that the ancient Chinese called the Qi, right? This is a real thing. These are the type of forces that acupuncture addresses and Reiki, things like that. And then the fourth is stress, chronic stress. I think it's something that's so underappreciated. But when you look at stress from a physiologic standpoint, it makes perfect sense, right? Increasing your sympathetic drive, which is your fight or flight. It increases your heart rate, your blood pressure. It releases cortisol, a steroid, which, if left in the system for too long, increases blood sugar levels,
Mm-hmm.
increases blood pressure.
Mm-hmm.
Okay. And in an acute setting, cortisol and other steroids are immunosuppressant, right? They reduce the inflammatory cascade, but when the body experiences these hormones chronically, it actually flips the switch and becomes pro-inflammatory.
Mm-hmm.
All right. So when you want to address heart disease and understand that at its most fundamental level, that it is a chronic disorder that's rooted in chronic inflammation, then the obvious answer is we need to address the chronic inflammation.
Yeah.
Well, these plant medicines, especially hemp and hemp-derived products, are incredibly potent anti-inflammatories.
Mm-hmm.
All
Mm-hmm.
right. And the reason why they have such a profound therapeutic potential is that they really target each one of these buckets that I discussed. It's been well documented to help reduce stress. All right. It's actually one of the most common reasons why I certify patients for this plant medicine is because it's an anxiety reliever, it's a stress reliever, right? From a nutritional standpoint, we have an endogenous cannabinoid system, which we don't, really learn about in school, but is one of the most profound homeostatic regulators of that we possess. And so anytime that we consume these plant-based medicines, it targets this system and helps to support this system.
Yeah.
So it could be viewed, excuse me, it could be viewed as a nutritional supplement. Okay. From a flow standpoint, it's been shown, especially certain products of it have been shown to increase vasodilation, which reduces blood pressure and helps to increase blood flow. All right, increase lymphatic flow.
Yeah.
All right. And in many cases, it's an antiviral, antibacterial, so it helps to mitigate the onset of infection. And so when you look across the spectrum of what chronic inflammation is, we see how plant medicines really address each one, which makes it such a powerful therapeutic.
And I think that's so important that you nailed it like you did, because a lot of people don't understand how stress is because of some type of inflammatory situation. Heart disease is caused by some type of inflammatory situation, because we do kind of go to the genes. Well, my mama had
That's
blood
right.
pressure issues,
Always.
my daddy had cholesterol issues, my grandmama had diabetes, and we
Right.
think of it from that standpoint. But when you look at wellness and how it can be prevented for each of us individually, I think it's important that you go down to that level that you just did. And it's important that people understand that, so that they can make those necessary changes in choosing, what do I want to do? Do I want to take the pharmaceutical route, or do I want to take plant medicine route? So what would you tell any of your patients that come into your office and you see that they have heart disease? What would you tell them if they're leaning towards the pharmaceutical route, which some people need pharmaceuticals? We're not saying people don't need pharmaceuticals, but
Sure.
how do you go through the process of helping your patients understand which preferred method is best for them?
Sure. Well, I say with anything that nothing is the miracle cure for heart disease or any disease for that matter. What plant medicine is a tool, you know. And I always make the analogy, you can't build a home with just a hammer, right? It's a tool, it's a powerful tool, and is a potentially dangerous tool if used inappropriately, right? But if used in the appropriate setting, you can amass a significant amount. Now, where I make the distinction between the pharmacologic route and the plant medicine route, I say in the acute setting, when things are really dire, um, the pharmacologic route tends to be very good. Okay. But when we talk about sustainability,
Mhm,
management,
mhm,
chronic, for sort of lifetime, first we're talking about lifestyle changes
mhm,
before anything. All
mhm,
right. And most of it is dietary, most of it is about getting around, moving around, exercising. But when we do need to supplement with either pharmacologic agents or with plant medicine, really the distinction comes in how severe and how acute are we at this very moment. All right. And that's why I see pharmacologic agent being an important part of our therapeutic regimen, is because it's good at addressing the acute issues.
mhm,
All right. But when we're talking about chronic problems, I tend to lean on the plant medicines because they tend to impact the body in significantly more ways than pharmacologic agents do.
mhm,
Just when you look at it, when you break it down from, I guess, from a much larger perspective, plant medicine allows you to target different pathways at one time because that plant contains so many different compounds. It's not just one active compound. And even the so-called inert compounds serve to support and synergize and balance these active compounds.
mhm.
All right. Whereas pharmacologic agents tend to have one mechanism of action that's unopposed. And so it's very targeted in that sense. And in many, many ways, this is why we get the myriad of side effects that we do, because it's not supported and balanced by these other compounds that you find present in plant medicine. We see this across the board. You take aspirin, for example. Aspirin, is one of the premier, pharmacologic drugs that we have, right? But itself is derived from plant medicine, like willow bark, for
Mhm.
example. It has the precursor for what aspirin is. You can pretty much consume willow bark all day, every day in modest amounts, and you're not going to have as much of an issue. You take 10 aspirin, that might be the last headache or whatever that you have. You
Yeah,
understand? Because it's a far more potent drug that only has really one mechanism of action.
yeah.
Whereas with willow bark, you have all these other different compounds which aid to support it. And so I'm always a huge advocate for plant medicine in its entirety because of this ability to target multiple things at once. And plant medicine tends to be far more alkaline and anti-inflammatory than many of our pharmacologic agents, for that matter. So, I'm a huge advocate for plant medicine, but again, we have to do it where it makes sense.
Yeah.
It's not for everyone at every point of their, therapeutic journey.
Yeah, and I think that's huge. And before we conclude here, Dr. Hinson, is there anything you would want to tell the viewers who are still on the fence about thinking about plant medicine if they're having heart disease? Any last words to someone who may be watching this and thinking, maybe I'll talk to my doctor about it? What suggestions would you give that person?
Yeah, I think it's just that. Speak to your provider about it. If your provider is sort of, not willing to engage in that conversation, I say, get a second opinion and speak to others. I think where medicine is going in an integrative direction, because we're understanding that what people need is more than just pills. Okay. It's very difficult to address the myriad of issues that a lot of people are going through with a single therapeutic modality. And so considering these other modalities and looking at the body holistically is really where medicine is headed.
And that is so huge. And I thank you so much, Dr. Hinson, for being on here today to give us those real great nuggets about plant medicine and how it can help those of our viewers who are suffering from heart disease, but also the other benefits of the plant. So I appreciate you being here on the Hive. And for our Hive viewers, thank you all for being here. Continue to follow us on the Hive as we continue to bring you great content about plant medicine and how it can save and change your life. Thank you so much, Dr. Hinson. I appreciate you.
Thank you.